Ian with you on BBC Radio Wales. Very good morning. If you're just joining us, very welcome to the programme. You may have noticed that some of the athletes at this year's Olympics, among them the swimmer Michael Phelps, have red circular marks on their bodies. They're caused by cupping, which is a traditional Chinese medicine treatment which involves having hot suction cups applied to the skin for several minutes. It sounds pretty painful, doesn't it? But it's claimed it can treat things like muscular and joint pains, skin problems and respiratory disorders as well. Let's find out a little bit more about this, shall we? Simone Davis is owner of Barefoot Medicine in Penarth and an acupuncturist and herbalist. Good morning to you.
Hi, good morning.
And we've also got Professor David Cahoon, who's a professor of pharmacology at the University College of London. Good morning, Professor.
Good morning.
First of all, Simone, I mean, you know, we put up a picture on our Twitter feed of this morning at BBC Radio Wales with these plastic cups attached to someone's back, I think it is, leaving these round red circular marks. It does look pretty painful. What are the benefits of it, and where did it all come from?
It does look painful. It certainly looks a lot worse than it is. But if I could just correct one of the first things that you said about applying hot cups. The cups aren't hot at all. These days we use plastic suction cups where the degree of suction can be controlled very carefully. You use a suction gun on the top of the cup, which slowly extracts the air from the cup, and that draws the skin up into the cup. And yes, of course, we've all seen the bruises that the Olympians have got from the cupping. Generally speaking, it doesn't actually bruise as badly as those that we've seen, but that depends on the degree of suction that's used. And of course, the patient at any stage can say that's too much or that's not enough or go further. So the sort of things that the Olympians' bodies endure is probably quite different to most people. And in fact, bruising would typically be very, very minimal. But the benefits of it are that it's a bit like having a sports massage or a deep tissue massage where you've got to break up the lactic acid in the muscles, get it all flowing again, so as to ease pain from trigger points in this case. There are other uses for cupping in Chinese medicine, but if I focus on the Olympians, it's basically to stimulate the circulation there, to flush out the lactic acid, and to help with flexibility and ease pain.
Okay, so it's supposed to help the performance of the athletes at the Olympics. David, you're sceptical though.
Yes, there's not the faintest evidence that it works, and it's sucking up a bit of skin is not going to do anything to lactic acid in your muscle. And there's certainly no evidence that it does, and you wouldn't expect it to. I would call it health fraud, pure and simple.
If people feel they're getting benefits from it, then why shouldn't they use it?
Well, if you like Michael Phelps, the rich as Croesus, so they can spend their money how they want. It's actually impossible to test whether you get a few milliseconds advantage. You know, in an endurance event, it can be people can win by a few milliseconds over 3 hours, and that's such a tiny effect that it's impossible to detect whether it's there or not.
Simone, a load of nonsense?
I think it's interesting that the professor says that it doesn't work, but you can't prove, there's no way of proving whether or not it can give the athletes any benefit. However, he does raise an important point about evidence-based medicine. And in an ideal world, yes, we would love to be able to conduct clinical trials into not just cupping, but all sorts of complementary therapies, alternative therapies, however you like to refer to it. It is important to have the evidence base, but if enough people are providing the anecdotal evidence, saying this is providing me with benefit, and above all else, as the Hippocratic Oath says, first do no harm, I think this is a great route to start with. If people are in pain and they can have cupping or massage that doesn't do them harm, but means that they don't have to take medication, then that's a great first start. And then if that doesn't work and they need medication, then so be it. But give people the choice and empower people to help themselves naturally first.
These pictures, though, look pretty horrendous, David, don't they, of these burn marks on people's backs and shoulders and so on. Are you worried that this could be dangerous?
Well, taken to extreme, there are some horrendous pictures, yes, of quite deep wounds. That's not generally the case. Generally, they're fairly superficial marks, I think. I'm glad your speaker acknowledges the need for evidence and also really acknowledges the need for the fact the fact that they haven't got good evidence. It seems to me that if you're going to sell a product as producing benefits, you need some evidence that it works. Otherwise, the door is wide open for fraud.
That's fundamental, isn't it, Simone? I mean, what's the point of doing it if there's no evidence?
Well, I completely agree with the professor that, firstly, the majority of occasions there is very minimal bruising and there is a need for evidence, and that's what we would want. The problem that we have in complementary therapies really is to do with health economics and funding for research. Who is going to pay for research into something that people could do at home, and then there's no return on the investment for the people conducting the research? At the end of the day, we don't have the backing that the pharmaceutical companies have to get the randomized controlled trials done that they have done for drugs. So this is a very different industry. We're not on an equal footing, but we would love to have the evidence. And to give you an example, one of my patients, or the family of one of my patients, actually funded research that I could do. They funded my master's degree to the tune of £6,000 because they said there is no way acupuncture, Chinese medicine, cupping is going to get the recognition that it deserves until the research is done. But the research can't be done because the majority of practitioners do not have the financial backing to conduct that research.
Fascinating stuff. I'm sure the debate will continue. Thank you both for your time this morning. Thank you for being with us. And if you've got any views on this, we'd love to hear from you. You can get in touch on the text or on our Twitter feed as well. Let us know if you've tried alternative medicines such as cupping or maybe all of these other things as well, acupuncture. Do let us know. We'd love to have your thoughts. Here's Hall & Oates and Man-Eater.